Thousands of veterans in Middle Tennessee rely on the VA health system for their medical care, but NewsChannel 5 Investigates has discovered equipment problems at the Nashville VA hospital that have forced the facility to cut way back on the surgeries it's performing. Consumer investigator Jennifer Krause looked into it. Jennifer, what's going on?
Well, Rory, Tennessee, I am told, is one of the fastest growing veteran populations in the country. But the VA hospital here is having trouble handling all that growth. And one veteran fears it's putting lives in danger.
I was in the Philippines, Okinawa, Japan, the Caribbean.
Ted Butler gave 9 years to the Marines.
First in, last out.
But the Hartsville veteran is frustrated, his wife angry.
I'm just livid about it.
They say doctors at Nashville's VA hospital told them back in March Ted needed double bypass surgery right away to fix 2 blocked arteries. He was admitted and set to have surgery 2 days later, but then suddenly the operation was canceled. Butler was sent home with explicit directions to take it easy.
Could you go back to work?
No.
Because?
I would have a heart attack. Might.
He was told his heart bypass would be rescheduled as soon as possible. But now, more than a month later, he's still waiting.
So if he has a heart attack or that burst in there, if it were to burst, he'd die immediately.
The problem? The number of surgeries here in the last 2 years has grown significantly, but the equipment hasn't been able to keep up. Namely, the hospital's 2 sterilizer machines like this that are used to clean the instruments after each surgery. As head of the Tennessee Valley Healthcare System, Jennifer Vedral-Barron is in charge of the hospital.
I need to feel confident that it is going to work every day. But given what we've seen over the last 6 months, I don't necessarily know that.
You don't trust it?
Personally, I don't trust it.
Hospital records, in fact, show one of the machines has been serviced nearly 3 dozen times in the last year. The other one has also needed repeated repairs. And every time one of them breaks down, administrators admit the hospital suddenly has more surgical instruments to clean than it can handle. So last month, the hospital chief ordered an immediate slowdown, cutting the number of surgeries performed here by half.
There's nothing we're not doing right now. We're just doing less of them.
Vedral-Barron insists veterans' lives have never been in danger. She says the hospital is still doing emergency operations, but putting off elective surgeries. And in many cases, veterans are being allowed to go outside the VA system for their operation.
Well, we've canceled everything for the next 2 weeks.
But the Butlers say Ted wasn't given the option to go to another hospital until just recently, after several weeks of anxiously waiting and repeatedly calling the VA for updates.
You're going to be on a waiting list because we can't get our equipment fixed. I don't understand that.
It turns out, though, the sterilizer was repaired nearly a month ago, but the hospital still is just doing a limited number of surgeries.
And what I've said is, let's not stress that system. It's very conceivable it could break down again tomorrow. I don't know.
So this is where you're probably saying, why don't they just get new sterilizers? Well, if only it were that easy. Apparently they'd been asking for them for some time, but emergency funding wasn't approved until last December. And because of government contracting rules, they couldn't just run right out and immediately buy them. Vets and their families feel the VAs let them down.
I don't understand how you can tell somebody we cannot do surgeries.
Some say these veterans earned this medical care, and they say they deserve more.
They do. You're absolutely right. I wish I could do 100% of our veterans every day. I do. But I also need to think of patient safety and what is the right thing.
So when will this all be fixed? Not anytime soon. The first of the new machines isn't set to arrive until the end of next month. The other won't be ready until late October. The VA says it expects they will be under this surgery slowdown at least until the end of May. As for Ted Butler, he's now been referred to Vanderbilt and is set to have his surgery there next week.